Hi, I'm Lilah Besser. I'm a research assistant professor here at University of Miami and at the Comprehensive Center for Brain Health. I'm a recent addition to the team here, and my background includes a master's in public health, in epidemiology, and environmental and occupational health, and then a PhD in city and regional planning. So my research program focuses on community and neighborhood environments, the built physical world, and our social environments, and how they may influence our brain health, aging, and Alzheimer's and related dementia risk. So today I'll be talking about the research that I do here at the Comprehensive Center for Brain Health. The bulk of the work I'm doing right now focuses on how do parks and green spaces affect our brains. So first I thought I would go through and describe what do I mean by parks and green spaces. So some definitions. And most people know what I mean by parks. They are public areas at the national, state, county, or city level. They're dedicated areas of natural vegetation and open space in our communities. So they're open for the public for relaxation, congregation, and recreation. And the public, they're often publicly funded as well as sometimes privately funded. So in the state of Florida, we have 11 national parks. Everglades National Park is the most well-known. And then there's 175 state parks and over 110 parks and recreational facilities in Palm Beach County, where we're sitting here in Boca Raton. And then lastly, in this city of Boca Raton, there are 36 city-funded parks. So that's parks, and they are just one of the types of green spaces that make up this kind of umbrella term for green spaces. And those are areas with natural and green vegetation, with grasses, trees, forests, shrubs, flowers, and other plants, farmland even. And they can be publicly owned areas like parks, or also trails, open spaces, street plantings, and you can also think about public streets lined with trees. And then they can also include privately owned areas, such as private gardens at your home or community gardens, lawns, yards, etc. So those are green spaces, and how can those parks and green spaces relate to our brain health? And there's many mechanisms that can help explain that. Parks can affect our mental health, reduce our stress and anxiety and depression. And a lot of people have experienced this during the COVID pandemic, where you need to get outside your home and kind of get some stress relief. And often people have been going to parks. They can also increase your exposure to fresh air and reduce the exposure to pollutants that you experience indoors in houses, but also air pollution from traffic on our streets. They affect our physical activity levels. Often people exercise in parks and green spaces. We interact socially with friends and others. It's been shown that spending time in parks and green spaces can increase our attention and concentration levels. And lastly, there is kind of an effect of exposure to chemicals and allergens from trees and plants. And that can affect our immune system and also our microbiomes, which is kind of the host of microbes that are living on our bodies. And this is especially important in younger ages, so in children. So these effects of kind of exposure to parks and green spaces over time can kind of accumulate and affect our brain health and our risk for Alzheimer's disease and related dementias. So beyond those kind of broader categories of how green environments can affect our brain health, there are more kind of biological mechanisms. So often people think of green spaces mostly affecting our mental health, air pollution exposure, physical activity levels, and social engagement. And those factors have been linked to brain health indicators such as inflammation and blood flow in the brain, cerebral blood flow, along with a number of these other indicators on the slide in the middle. Those in turn are related to our brain structure and function and can be seen on things such as magnetic resonance imaging. And then also detected, those changes that can occur from exposure to green environments can be detected through cognitive testing and late life cognitive functioning, as well as dementia risk. So why are studies of parks and green spaces and brain health significant when kind of a big bulk of the work on Alzheimer's and related dementias is kind of focused on medical treatments and drugs that may help cure or kind of stop the pathology in its tracks. And it's important to understand that our risk for developing Alzheimer's disease, about up to 40% of that can be attributed to lifestyle factors such as depression and physical activity. And parks and green spaces directly affect those things. And people have an intrinsic connection with nature, and evidence is building for the health benefits of nature contact. So creating and maintaining health-promoting built environments, including parks and green spaces, has the potential to encourage healthy lifestyles throughout our lives, improve our quality of life, and importantly, target multiple health conditions that we can experience throughout life, and especially during later life, including depression, cardiovascular and cerebrovascular disease, and Alzheimer's and related dementias. So it's also important to understand that green spaces and parks are really distributed differently within cities and towns and also across regions such as the US. And our access to parks, public parks, can really vary by city. So for instance, in Boca Raton, where we are, only half of residents are within a 10-minute walk of a park. And that's compared to Miami, where 87% of residents are within a 10-minute walk of a park. Places like New York City, 99%. Just pretty much everyone living there is within walking distance of a park. And also the density of trees and other kind of tree canopy cover can really vary by city and within city. And that's important not only because trees can help us and can encourage us to go out into our neighborhoods and walk and have positive health behaviors, but also trees can really lend a lot of shade in places that don't have tree canopy cover. They can be 20 degrees Fahrenheit or hotter on the hottest parts of the day. And so the places without trees are called urban heat islands. And that can be distributed differently depending on place as well. And of course, heat discourages people from getting out and walking in their community environments. So I'm going to go through 3 examples of the research studies that I've done on parks and green spaces. But first, I wanted to talk about why my research focuses on neighborhood environments and green spaces specifically, and also define neighborhoods. So neighborhoods are just generally the areas within walking distance around your home. There are different definitions depending on the research study, but that's the general gist of what neighborhoods are. Most people kind of have an intrinsic understanding of that. And with increasing age, we're at increased risk for developing Alzheimer's disease and related dementias, but we're also spending more time in our neighborhood environments. And this is because we have less or no driving as we get older. We retire, so we're not spending time out going to work every day. We may have fewer friends and family nearby with shrinking social networks as we age. And then mobility and medical issues can kind of affect how often we leave our homes in our neighborhoods. And so my work focuses on how can we design neighborhood environments to support brain health, reduce the risk for developing Alzheimer's and related dementias, and then allow individuals to age in place. Stay in their neighborhoods and homes for as long as they desire to. So the first study has been published and is looking at neighborhood green space environments and how much do people walk in their neighborhoods. And this study was focused on older adults using the National Household Travel Survey, which is conducted periodically and asks about travel behavior amongst a large sample of Americans. For this study, there were 72,753 older adults included, and older adults meaning 65 and older. And the outcome was their self-reported number of minutes that they walked in their neighborhoods per day. So the study aimed to determine if neighborhood open and park space and tree canopy was associated with minutes of neighborhood walking per day, and also do those associations kind of vary or depend on the person's race, ethnicity, or their gender. So here I'm going to kind of show how these kind of neighborhood green space environments are measured in these kind of studies. And in this case, and often in a lot of my studies, you're using kind of objective measures. So either maps to determine how much green space is in the neighborhood area, or in this case, using the National Land Cover Data Set, which is based on satellite imagery. So the satellites orbit the Earth and take these little 30-meter grid images across the US, and then it's all compiled together. And then each of those little images is classified based on that land cover type. So it could be how much water, how much paved area, how much forest and grassland, etc. And we're using that classification to define how much neighborhood green space there is for each participant. In this case, the measures are how much developed open park space, which is, of course, including parks, but also large housing lots, golf courses, aesthetic plantings, and then how much of the neighborhood is composed of tree canopy and cover, which includes, all kinds of trees, deciduous, evergreen, and mixed forest. And in that study, we found that having more open and park space in the neighborhood was associated with more neighborhood walking in African Americans specifically, but greater tree canopy in the neighborhood was associated with more neighborhood walking in the overall sample amongst women and white individuals. And this is significant because not many studies have yet directly tied how much green space you have in your neighborhood to actually participating in more physical activity in your neighborhood. And also we found that green spaces have the potential, at least, to encourage walking in one's neighborhood. And that's important because, as I mentioned before, walking and other forms of physical activity can help reduce the risk for Alzheimer's and related dementias. And also we found that green space type may be important for considering when you're trying to encourage neighborhood walking, because it may depend on kind of your individual characteristics, such as your gender or your race, ethnicity. So the second study is looking again at neighborhood green space, but in this case, park space or park access, and how cognition changes over time in older adults. It uses this multi-ethnic study of atherosclerosis, which is this long-term study that follows individuals over time to understand cardiovascular disease. We had 1,733 participants, and using those participants that have been enrolled from 6 US regions. And they had to have cognition measured at 2 time points so we could see the change in cognition over time. This multi-ethnic study of atherosclerosis is very diverse, so 29% African Americans, 17% Hispanic, 11% Chinese, and the remaining white race. And the study aimed to determine if having more park space in the neighborhood is associated with maintaining or improving cognition over time among older adults. So the exposure was similar to kind of the previous study, in which it's defined based on the percentage of the neighborhood composed of park space. And that was determined based on publicly available data and maps. You can just kind of determine how much is how much park space is there. On average, the participants had 5% of their neighborhood composed of park space, but it really ranged from 0 to 52% depending on the person, where they lived in their city, and also which city that they lived in. And the outcomes were change in test score over time on 2 cognitive measures. The first is the CASI, which is a measure of global cognition, or how well is someone functioning cognitively, kind of on an overall basis. And then the second was digit symbol coding test, which measures processing speed, which gets at kind of the time it takes someone to respond and process information. We found that having greater neighborhood percent park space was associated with maintained or improved global cognition over time, and the association seemed to be stronger among African American versus white individuals. And the implication is that promoting new neighborhood park spaces may be particularly beneficial to the cognition and maintaining and possibly improving cognition amongst African Americans. And this is important because often this population has reduced access to other opportunities for physical activity that parks provide. And then the third study is looking again at neighborhood green space, but this time the outcomes were brain imaging measures from magnetic resonance imaging. And so the study aimed to look at whether living in neighborhoods with more green space is associated with better brain imaging outcomes, also in older adults that were part of the cardiovascular health study. And this is, again, a long-term study that followed people over time, restricted to individuals who were 65 and older from 4 regions across the U.S. Our sample size was 1,125, and this study was primarily white. So 89% of the participants were white, 11% Black. The exposure of interest was neighborhood percent green space using that same national land cover data set classification. Participants on average had 38% of their neighborhoods composed of green space, but it ranged from 1 to 99%, again, depending on where they lived. And then the 3 brain imaging outcomes were 1, total hippocampal volume. So the hippocampus is an area that's affected early on in the course of Alzheimer's disease. So if you have a higher hippocampal volume, it means there's a greater volume, less atrophy or less shrinkage of the brain. So that's, better brain health. And then the second brain imaging outcome was ventricle grade score, with a greater score meaning more atrophy or worse brain health. So the ventricles are the cavities of the brain. You can think of it kind of like the negative space. So the gray and white matter, if there's more of it, then the ventricles are smaller. If you have shrinking of the brain, then the ventricles get larger, and that's worse. And then the third brain imaging outcome was white matter hyperintensity score, with higher scores meaning higher white matter tissue damage. And white matter lesions such as these have been associated with increased risk for cerebrovascular disease, including stroke, and also dementia and cognitive decline. So a higher white matter hyperintensity score, worse brain health. And we found that those living in neighborhoods with greater percentage of green space in the 5 years prior to having that magnetic resonance imaging, or MRI, had lower ventricle grade scores. And this suggests less brain atrophy or a brain health benefit to living in greener neighborhoods in later life. So these studies are kind of intriguing and pretty new, this topic of research. And they're just kind of preliminary. So there's a lot to be done to really understand kind of the links between green spaces and parks and brain health. For instance, understanding what types of green spaces are most beneficial, and does it really depend on the individual's characteristics and things such as this. But the ultimate goal of my work is to provide evidence for associations between having greater exposure to these neighborhood green spaces and seeing improved brain health amongst those individuals. And if we see that, then we can use that to help inform policies and funding at the local and maybe higher levels to increase the amount of neighborhood parks and green spaces, particularly for individuals that have few green spaces available to them in their neighborhoods, or also have poor quality green spaces. So that's the end of my talk, and after Dr. Galvin has his presentation, I think we'll have time for questions. Thank you.